A patient walks into the emergency room after a scorpion sting. He is in pain, but he is stable. Vitals are very normal. ECG looks fine and pain is controlled. So, you think this patient is safe? We'll see in a different scenario. 4 hours later, he is gasping for breath, blood pressure crashing, and now he is shifted to ICU. What went wrong? This is the most dangerous mistake in scorpion sting. Not the sting, not the pain, but the false sense of safety. Hi, this is Dr. Samrat. As usual, I am back with the emergency case scenarios. And today, I will show you why scorpion sting patients look fine first and then suddenly collapse. Emergency department versus ICU mindset. In the emergency room, we stabilize the patients. But in the ICU, we do something more important, which is we prevent the organ failure. And the scorpion sting is not about the pain. It's about what the venom does inside the body. That is the monster attack, which is autonomic storm. Scorpion venom triggers a massive autonomic storm. Suddenly, the body releases huge amounts of adrenaline. With huge amount of adrenaline, there will be a shoot up of heart rate and increase of blood pressures initially. The heart rate is forced to work harder and harder until it cannot cope anymore. That is why the patient looks stable at first and then suddenly deteriorates. The heart is the main target organ. This patient can develop myocarditis at any given point of time and may land into left ventricular failure and a dangerous arrhythmias. Blood pressure may look high initially and then it suddenly drops. The killer is the pulmonary edema. The most common cause of death in scorpion sting is the pulmonary edema. Fluids floods the lungs. Now, here's the common dilemma in ICU. Give too much fluids, lungs will drown. Give too little fluid, shock worsens and patient deteriorates. This balance decides life or death. Usually, children are at even higher risk. They have less cardiac reserve and they can crash very fast and they need ventilatory support at early. Never underestimate scorpion sting especially in children. Why ICU admission and when ICU admission for a scorpion sting? Any scorpion sting patient with a breathing difficulty, with a low blood pressures and arrhythmias and altered sensorium or a pediatric case with a systemic signs must go to ICU. Whenever we have doubt, observe in ICU. In ICU, monitoring is not an optional thing. It should be monitored as a continuous ECG support, continuous oxygen support, continuous blood pressure monitoring, and most importantly, early echo. Because echo changes appear before the patient collapses, and we can easily assess the heart left ventricular dysfunction. Now let's talk about the drug that changes everything. The real game changer, the prazosin. Actually, the prazosin, it reduces afterload. It calms the autonomic storm and it improves the cardiac output, and most importantly, it saves your lives. Delayed prazosin means the patient will be in a ICU for a longer time and there will be higher risk to the patient. Now, the most tricky part in the management, which is applying biggest mistake, which is a fluid resuscitation. Fluids must be given very carefully in small boluses only, guided by blood pressure, urine output, and echocardiography. If the left ventricle is failing, dopamine is preferred because here it maintains the blood pressure and the workload will be minimal and there will be no increased arrhythmias. Don't go for dopamine. Dopamine as it increases arrhythmias. So avoid dopamine. So the most common question here comes is when to intubate the patient with a scorpion sting. Yeah, definitely. Because the patient lands in pulmonary edema at earliest if we don't manage in a sequential manner. So oxygen should be started very early if required, and in pulmonary edema non-invasive ventilation should be started for mild to moderate cases. But if there is a severe hypoxia or exertion, do not delay intubation. Early intubation support, early ventilatory support reduces the cardiac stress. The most common mistakes which we do in ICU while managing the scorpion sting is treating only pain. Treating the pain with painkillers and as well as some lignocaine, local lignocaine, and some cold compressions. And the second one is delaying the prazosin. If you delay the prazosin, there will be more risk to the patient. And overloading the fluids, which leads to pulmonary edema. And ignoring the echocardiography. If you get an echo, there will be more chances you can assess what is the function of heart. And underestimating the pediatric cases. Remember this. Pain severity does not reflect venom severity. Normal vitals do not mean the patient is safe. Early prazosin, careful monitoring, and timely ICU care definitely saves lives. If this helped you think differently, like, share, and subscribe. Thank you for watching. This is Dr. Samrat. See you in the next emergency case.